President Obama's weekend swine flu emergency declaration gives doctors and hospitals new flexibility in handling what could be a surge of patients.
UNM Hospital has already set up a special area away from the emergency room for handling people with flu symptoms. News 13's Kayla McCarthy checked with the city's other two major hospitals today to see what they're planning if the numbers continue to climb. Caitlin?
Jessica, Presbyterian and Loveless have similar setups to UNM Hospital, keeping people in one area to contain the spread of any illness as best as possible. Everywhere you go inside Loveless Medical Center, you're reminded of the flu. If you come in with flu-like symptoms, you need to put on a mask and come here.
That way, we're protecting the patients who are in the other ED and kind of segregating everybody so that we try to keep everybody as healthy as possible.
Clearly, it's calm today, but so far this month, Loveless's ER has seen thousands of patients complaining of flu-like symptoms. That's why the hospital has been using what little vaccine it has on its healthcare workers, the people on the front line. Loveless hopes that'll change soon as the manufacturers start pumping out more vaccine.
It should be ramped up in the next few weeks where more pregnant women and other high-risk groups will be getting the vaccine.
Loveless has a plan in case sick New Mexicans flood the hospital.
We're looking at alternative scenarios for if in case we have too many patients coming into our hospitals, including triage tents outside, using other areas of the hospital that we haven't previously used for patients.
At Presbyterian Hospital, as soon as someone comes in with flu-like symptoms, they're sent to this room here, given a mask and hand sanitizer. Presbyterian is encouraging people who don't have a fever to stay away from the ER.
What we would really like is to limit the panic and know that most patients are experiencing the symptoms. They're lasting for 5 to 7 days, and they're able to resume normal activities.
But if your fever does spike or your symptoms get worse, Presbyterian advises to see your doctor or come to the hospital. And if Presbyterian sees a massive amount of sick people coming in, officials there say they're ready. They have 36 clinics around the state and 3 emergency rooms in Albuquerque. Back to you.
Okay, Caitlin, the national emergency was declared because of the growing number of patients, not because the disease itself is getting more severe or death rates are getting worse.
There's still not enough swine flu vaccine to go around, and now the seasonal flu shot supply is getting shorter. Presbyterian Hospital says because of increased flu awareness this year, more people want to be vaccinated. Also, manufacturers are concentrating on making swine flu vaccine and reducing their production of the seasonal flu meds. Presbyterian held a free seasonal flu shot clinic at the North Valley Senior Center today. About 200 people got them.
I get one every year, and ever since I've been getting these flu shots, I've been getting the flu.
Because if I don't get a flu shot, I end up in the emergency room.
Is this something you do every year?
Every year.
But the clinic at the North Valley ran out, and some people were turned away today. Presbyterian will hold 3 more seasonal flu shot clinics. For dates and locations, log on to krqe.com and then click on